Latching on is the term describing how the baby attaches to the breast. Understanding and mastering the steps to latching on is the key to a successful, satisfying breastfeeding experience. In the next few minutes, we'll show you some ways for proper latching on. It's easy and a uniquely wonderful experience for you and your baby when you know how. First, get into a comfortable position with support for your back. You may also wish to have a drink nearby to keep hydrated. You can use pillows for support. Elevate your feet to raise your lap slightly. Choose a position for your baby that works well for both of you. Here are 4 common ways to hold your baby during nursing. The cradle hold. Baby's head lies in the crook of your elbow or on your forearm. The cross cradle hold. Your arm goes around baby's back. You support baby's head with thumb and forefinger behind baby's ears. The clutch or football hold. Baby lies on his back between your side and your flexed arm. The side lying hold. You lie on your side facing baby. Experiment to find the position that works best for you and your baby. Whichever position you choose, your baby should be close to you with his mouth and nose facing your nipple and his hip, shoulder and ear aligned. Support your breast by forming a C or a U with your thumb on one side and your fingers on the other. Be sure your fingers are far enough away from the areola that they don't get in baby's way. Gently support your breast, being certain that your breast is in line with your baby's mouth. When baby's mouth is wide open, bring baby to your breast. During a correct latch, hold the baby's chin to the breast so he can bring his upper lip over the top of the nipple with his neck slightly extended. It's important baby latches onto as much breast tissue as possible with his top and bottom lips flanged open like a fish. Most of what baby takes in comes from the part of the breast closest to his chin. In this technique, known as the asymmetric latch, the nipple is pointed toward the roof of baby's mouth. For very young babies, it's very important to ensure that baby has a latch as wide as possible, as incorrect latching in the early days can quickly lead to soreness if not addressed and recognized. If latching on is done correctly, baby's chin will touch your breast and his head will be tilted back slightly. Baby's nose will almost touch your breast. Baby's lips will be flanged, that is, you should see both his upper and lower lips on your breast if you look closely. Baby's cheeks will be rounded and his temples will wiggle. And you'll be able to see his jaw working to help in swallowing the milk with pauses for swallowing. When baby is done, he will let go of the breast or just fall asleep. It's also quite normal for babies to take a short break during feeding. It is normal in the first few days to experience discomfort while your baby is learning to latch, but breastfeeding shouldn't cause great pain. If you feel pain, don't be afraid to gently detach your baby by inserting a clean finger in the corner of his mouth. After you detach your baby, wait for an open, wide mouth and latch him on again. You could even try latching him in a different position. If pain persists or your nipples become sore or damaged, help is only a call or a click away. In most cases, just a little added guidance in how to latch on may be all you need. So relax and take time to enjoy a uniquely wonderful experience.